So a clean and press would be for someone who has lifted in the past and is getting back to lifting, likely. But the idea of a clean is you're coming from almost a deadlift position here, and you're bringing the weights up in a fast motion, coming up to this position. So it'd be here, and you're coming up to this position, and then if you're pressing overhead, like this. Back to the shoulders, back down to the waist, and then come down, clean, and press, and back down.
All right, this is a deadlift. It's similar to a Romanian deadlift. You'll just have weights in both hands, and then you want them to keep their back straight and moving at the hips. So their hips will kind of push out as they're going down. If there's a slight bend in their knees, that's okay. And then as they're coming up, they're moving their hips forward. Again, just going up and down like this. Another thing that's important to watch for is just make sure that when the patient is bending over, that they're using correct technique, or if they're doing a squat. So we don't want the patient to just bend at the back, especially if they're having back pain. So we want them to keep their back pretty straight, bend at the hips and at the knees as they go down, just so that they're doing it correctly. Same thing with a squat, just making sure it's good form and just correcting them as needed. All right, this exercise is called standing X's with the sports cord. So you'll have the patient put one sports cord around their ankle, and then they'll hold the other one in their opposite arm, and then they're just gonna go like this, 3 sets of 15. You want the resistance to be pretty close to the same for the arm and the leg. Usually the arm's harder, so they can do a little bit lighter on the arm, and then they'll just switch and do the other arm and leg for 3 sets of 15. These are called X monster walks with the CLX band. So what you'll do is you'll have the patient put their feet in 2 of the loops right next to each other. They cross the band and then put their hands at the end. Then they do a normal monster walk, where they're kind of in a sports squat like this. And as they're stepping out, they're also bringing their hands up. So they just kind of go out like this. And then they do the same thing going forward and do the laps around a counter or table.
The multifidus is a small muscle in your back, only this big. It goes between small segments, so it's not very large. So the idea is you're doing a bouncing motion that's putting a little bit of torque on your back, and you're just trying to keep it upright. Patients won't feel like a huge stress when they're doing this, and that's okay. But for example, if you're doing it for the low back, you can come out, pull some tension here, and then you can lift an arm, and then you're bouncing the arm like this in a certain position. The higher your arm is up, usually the higher it will be in your back, and the lower it is, the lower it will be in your back that those muscles are working. And then you can alternate arms and do the other side like this. If they're doing it right, if you feel right on their spine as they're bouncing, you'll feel those little muscles right next to the spine turn on. Okay, neuroglides for the back. There's a lot of different ways you can do these, but I'm just going to show you the idea. So the idea is you're creating tension on one side of the nerve while there's slack on the other side, and then reversing that. So for example, one of those that you can do is you can have your leg straight and your foot pulled toward you, and then I have my head back, and then as I point my toe, I would put my head down like this. So I'm creating tension on the nerve high, releasing the tension low, and then I can come back. So you can do any sort of motion like this. It can be with the spine hunched down, you're pointing your toe, or pulling your toe back, and then you're coming up and doing the opposite position. So up and back, point down. So these can be done for the neck as well. So for example, one of them is you're pulling your wrist back and looking at your hand, and then putting tension on the neck as you pull the hand back like this. So you'd come towards, looking towards the hand, and then back, coming away. There's many different types of these, so the therapist would have to show you if they're different, but the most common ones would probably be this one that I just demonstrated to you earlier, where you go relieve tension, toe towards you, point the toe, and go down. And then for the wrist and arm would be look towards the palm like this, and then go away.
All right, so this next exercise is called windmills. So they're gonna start just like this, and they're just reaching down to their opposite toe, coming back up, just alternating. So
all right, this is a modification of the piriformis stretch, or the figure 4 stretch, as we also like to call it. So you have the patient bring their leg up on the table like this, and they just kind of sink down until they feel the stretch in their piriformis.
Okay, a lumbar gapping stretch is basically a lower lumbar rotation. So they're going to be laying on their back here, and then they're rotating their body and pulling their leg across and keeping their shoulder down. So it's not a glute stretch, which you've seen before, which is hips down and pull across, but you're actually rotating the spine and holding it there.
This is the lat stretch, and there's two ways that they can do it. The first way is they just grab onto something high and kind of sink down low just to get a stretch in their lat. If they feel the stretch more facing sideways like this, they can adjust and do that. And then the second way is they can come over to a table or a counter with their arm up, and then same thing, just sinking down to get a stretch in that lat.
Your quadratus lumborum is this muscle in your lower back right here. So the idea for stretching it is you're trying to create a C shape where your hip and your ribs are coming apart right here. So you can do it, if anything you can grab onto, but so for example, you find a door. If I'm stretching my right side, then I'm gonna put my right leg behind my left, and then I'm gonna push my hips out. So I'm creating this space here. They can rotate slightly depending on if they feel a better stretch, but they should just feel it right in this lower back area.